Hi everyone, welcome to Sonogrip. Today we are evaluating a vital post-operative case study which is Rectus Sheath Hematoma, a 38 years old multigravida female who underwent total abdominal hysterectomy 3 days ago and now complaining of severe localized lower midline abdominal pain. When a post-surgical patient presents with acute pelvic distress, our immediate objective is to rule out deep pelvic complication such as vaginal cuff hematomas, localized abscesses, or free intraperitoneal fluid. So let's start the scan. What we got. To thoroughly evaluate the surgical bed, the standard protocol requires a semi-distended acoustic window. So in this case, Foley catheter was temporarily clamped. This simple maneuver retroverts the urinary bladder, slightly allowing us to assess the deep pelvic spaces. On trans-abdominal evaluation, the uterus was surgically removed, showing standard post-operative changes, no adnexal pathology identified, and no free fluid seen in pouch of Douglas. So, with deep pathology effectively ruled out, the scan must be shifted to superficial assessment. We see interior to the abdominal wall musculature and confined within the rectus sheath, we identify a well-defined, complex, heterogeneous fluid collection with internal echogenic components representing clots. This appearance is a pathogenomic for an acute or subacute rectus sheath hematomas. These hematomas typically results from surgical trauma or laceration of the inferior epigastric arteries during incisional closure. While doing the scan for such patients, first ensure you can closely visualize the posterior rectus fascia to confirm the collection hasn't breached the peritoneal cavity, and secondly, evaluate the collection to rule out active arterial pseudoaneurysm or active bleeding. Here, in this case, the collection is completely avascular, confirming a stable, non-active hematoma as the color Doppler shows no internal vascularity or any kind of active bleeding. Let's summarize all the findings, what we report for this case. Uterus is surgically absent. The vaginal curve is intact with normal postoperative changes, no adnexal pathology seen, no deep pelvic mass, localized abscesses, or free intraperitoneal fluid collection. A well-circumscribed, complex heterogeneous fluid collection confined within rectus sheath interior to the abdominal wall musculature. The collection measures about 12 into 6 into 4 centimeter and the volume measure approximately 150 ml. Color Doppler shows no evidence of internal vascularity or active pseudoaneurysm. And for impression, rectus sheath hematoma within interior abdominal wall. Thanks for watching. Please like the video and subscribe to Sonogrip for more videos.